Yes, we've known for some time that heart failure, which results in accumulation of fluid in the body and produces shortness of breath, occurs in two basic types. In one case, the heart muscle is weak and it pumps out a smaller percentage of its volume than is normal. In the other case, which produces a very similar clinical picture, the heart muscle is strong, but it's stiff and it does not relax properly. In either case, the pressures within the heart rise, and that leads to a rise in pressure in the lungs, and that produces breathlessness. As the disease becomes more advanced, uh, fluid accumulation occurs and people notice swelling. We studied patients who did not have heart failure, but some of whom did have a stiff heart, not bad enough to cause breathlessness and swelling, but enough that we can measure it with ultrasound or echocardiography. And it's been known for some time that heart failure due to a stiff heart can produce enlargement of the right side of the heart that pumps to the lungs. So the stiffness applies to the main pumping chamber, which is the left ventricle. But the blood comes into the right side of the heart from the rest of the body and gets pumped to the lungs where it picks up oxygen. And then it moves on to the left side of the heart to be pumped out to the rest of the body and your organs. When the left side becomes stiff and a patient develops heart failure, the pressures in the heart rise, the pressures in the lungs rise, and the right half of the heart that pumps blood to the lungs can be enlarged and even weakened. We've known that. What is less clear, and what we studied, is does stiffening of the left side of the heart by itself cause abnormal function of the right half of the heart, even if the patient doesn't have clinical signs and symptoms of heart failure? So we looked at 370 patients who came into our echocardiography laboratory for whatever reason, and we measured the stiffness of the left ventricle using standard guidelines put out by the American Society of Echocardiography. And then patients were classified as having normal, what we call diastolic function, mildly abnormal, or moderately to severely abnormal. We put them into those three bins. And then we looked at the size of the right ventricle, which is the half of the heart that pumps to the lungs. And we looked at the effectiveness of its pumping, what percentage of the blood it put out with each beat. And what we found was, as diastolic function of the left ventricle worsened, as that main pumping chamber became stiffer and didn't relax well, the right ventricle became larger and its pumping function, measured by what we call the ejection fraction, fell. So, what this means is that as the left ventricle stiffens, which is very, very common, basically any disease of the heart will cause stiffening of the left ventricle. Aging to some extent causes stiffening, but mostly it's due to disease, even things such as high blood pressure. As that process progresses, the right half, the right half of the heart shows signs of strain. Its pumping function decreases and ultimately it enlarges. There are other things that can cause the right side of the heart to enlarge and to weaken, but many times we see such an enlargement or weakening, and we can't identify one of those other causes. And that's what makes this research relevant. It's likely the case that many patients with otherwise unexplained enlargement or weakening of the right half of the heart have this problem because the left half of the heart is becoming stiff. Right now, we're at an interesting time in cardiology because the type of heart failure which is due to stiffening finally has some effective treatments. For years, we did not have such treatments. And it's an open question whether applying those treatments to patients who have stiffening but have not yet developed clinical heart failure might benefit from these medicines in order to prevent enlargement and weakening of the right half of the heart. Grade 1 diastolic dysfunction is currently the subject of a lot of controversy. Traditionally, we have believed that grade 1 diastolic dysfunction of the left ventricle means that the pressure in that ventricle is only high at the very end of the filling period that we call diastolic diastole. It looks, however, like patients with grade 1 diastolic dysfunction can develop heart failure with preserved ejection fraction, the heart failure due to stiffening of the left ventricle. So we had previously considered grade 1 diastolic dysfunction benign. Now we're not so sure. And I think our research also supports that it's not benign. It doesn't represent a very early stage that you can merely observe, but it represents the beginnings of real disease that can have measurable effects on the size and function of the right half of the heart. An interesting question. We always perform echocardiography at rest, but most of us are up and active while awake. And the physiology we measure at rest does not necessarily reflect the physiology during exercise. So it's quite possible that patients who have grade 1 or mild diastolic dysfunction at rest develop more severe diastolic dysfunction with activity, and that diastolic dysfunction is what's actually having adverse impacts on the right side of the heart. Well, we controlled for the pulmonary artery systolic pressure because pulmonary hypertension, high blood pressure in the lungs, is known to have adverse effects on the right ventricle. And we wanted to make sure that the changes we were seeing were not due to higher blood pressure in the lungs in the patients who had the observed changes. There are interactions between the ventricles across the septum. How much those are contributing to our results is unknown, but likely there is some influence there.